This afternoon, we continue getting your emails about trouble with the Kansas Department of Labor. Leaders with KDOL says they've made improvements to the call center to process claims, but investigative reporter Matt Fleener spoke to one man who says the problems are getting worse.
You will need to call back later. We apologize for the inconvenience.
It's the same thing.
Another day with hundreds of calls.
Since February 22nd, 200 to 400 phone calls a day. Not one has been answered.
Nick Shipp says the Kansas Department of Labor owes him more than $10,000.
What could you do with $10,000?
Pay rent first and foremost. She's our youngest, she's 2.
Shipp has family to take care of, saying KDOL's promise to hire more people to answer calls hasn't helped him.
Since they've done their server mitigation upgrade and supposedly hired more folks, I haven't been able to speak to anyone.
A Labor Department spokesman said he would pass along Mr. Shipp's information, but declined an interview about where things stand with the call center. KDOL leaders have already spent around $30 million to hire private consultant Accenture, saying they've added 500 customer service agents and surge staff. But for more than a month, the KDOL spokesman has not answered KMBC9 Investigates specific questions about staffing levels, including fewer employees listed in contracts with Accenture than leaders have publicly said.
I don't know who to turn to anymore. Place another 20 or 30 phone calls, hoping to get through.
Shipp just wants people to know he needs answers from the Labor Department.
It's an uphill battle, and I don't need any more obstacles.
Matt Fleener, KMBC9 News.
Kansas Department of Labor leaders have started doing television interviews again after death threats last month, but again, they declined an interview today. The CDC is easing its guidelines for those who are fully vaccinated. It now says fully vaccinated people can visit those who have not gotten the vaccine without restrictions. But they do suggest the visits be limited to one unvaccinated household at a time. You should still wear a mask if the unvaccinated family or friend is older, pregnant, or at high risk. Masks are also encouraged if 2 unvaccinated households are together. Health officials consider people fully vaccinated after 2 weeks have passed since receiving the second dose of vaccine. Kansas is hoping to get as many as 100,000 added doses of the Johnson & Johnson vaccine as early as next week. Our Michael Mahoney has more on what that means for the state's vaccination process.
100,000 more doses of the single-shot Johnson & Johnson vaccine would be roughly a 2/3 increase in the state's weekly vaccine supply.
The ramp up in production has been a big goal of the Biden administration, and I'm hopeful that what I hear from the folks in Washington translates to more vaccine for Kansas.
Nielsen is Governor Laura Kelly's top advisor on the pandemic. At this time, she does not expect an increase in the state's supply of the Pfizer or Moderna vaccines. Missouri Governor Mike Parson is expecting his state supply to increase in the coming weeks as well. The JJ advantages include it's a one-and-done shot, and it does not have to be stored at super cold temperatures. It could be used for Kansans most vulnerable to the virus.
In mobile units, for example, to those places that are the most susceptible to COVID, both illness as well as death.
That would include parts of Wyandotte and Johnson counties. And with more vaccine and expansion, Nielsen thinks vaccinators are not going to press as hard on eligibility.
So we are going to be operating on the honor system, anticipating that people in phases 3 and 4 know who they are.
That would be people between 16 and 64 with medical conditions, as Kansas is hoping for a big increase in its vaccination supply as early as next week. Michael Mahoney, KMBC 9 News.
Another plan Kansas is exploring is getting more vaccines to doctors' offices so they could start vaccinating their patients. A newly released survey found nearly half of healthcare workers nationwide remain unvaccinated. 52% say they have received at least 1 dose of a COVID-19 vaccine, leaving 48% who have not. That unvaccinated group includes some who have their shots scheduled, but 3 in 10 say they will not get the shot. We want to help you get signed up for vaccination. Here's a look at the process at Hy-Vee pharmacies. Once you sign up to get vaccinated through your city, county, or state, you can sign up for additional opportunities to get the COVID-19 vaccine. Hy-Vee pharmacies are offering vaccinations. Go to Hy-Vee.com. Click on the light blue box labeled Questions about the COVID-19 vaccine. Here, you'll find a dark blue box labeled Find Appointments. Due to heavy activity on the site, there might be a wait time. When it's your turn, scroll to the bottom of the page. You can enter your zip code to see if there's vaccine available at a store near you, Or check to see availability at one of Hy-Vee's vaccination events. If there are available appointments, scroll to the bottom, answer eligibility questions, and click on Reserve a Time Slot. Choose a vaccination time, then click Continue. Here you'll be prompted to fill out a consent form and insurance information if available. If you don't have internet access, you can call your local Hy-Vee pharmacy. Some locations will add you to a wait list. Again, to get a vaccine, make sure you're signed up. You can go to KMBC.com and click on the How to Get a Vaccine option. You can also point your cell phone camera right at that screen, the QR code there, and there you'll find information on the state and county where you live.